Within our health system here in Northwest Wisconsin, I think that we have a lot of variable opportunities for our residents if they have an interest in acute care as well as ambulatory care. And so our residency programs are designed to help residents tailor the program to their practice interests. So if a resident has more ambulatory care interests, they have the opportunity to pursue more elective rotations in that particular area versus having an interest in emergency medicine or critical care. The goal of all of our programs is really to create a well-rounded pharmacy practitioner and be ready to step into any pharmacy practice role that they pursue after residency.
I felt really welcomed, really included. I could tell that the preceptors here really had a strong passion for teaching. Beyond that though, just beyond the pharmacy staff, I could tell that I was really welcomed and included by the whole care team. Providers, doctors, nursing staff. We're really inclusive in our learning experience as well. They're really used to having learners on rotations with our pharmacists, and so really expect a high level experience.
Mayo Clinic's values really impress me because they are all about patient care and how we can do the best for our patients. So it's advancing practice for patients, diving into education and research for the benefit of patients. And that really hits home with me that we are serving patients and putting our skills to good use in that purpose.
Early on in my training in education, I did a rotation here and was just blown away by one of our preceptors here. She spent so much one-on-one time with me. I wasn't just given some tasks and kind of set aside. We spent a lot of quality one-on-one time throughout the rotation and felt like I had learned so much.
To get through residency year, it's important to make relationships with your co-residents and kind of lean on each other throughout the entire year. They are the only ones that know exactly what you're going through at the different points in the residency year. So really leaning on each other is important.
Mayo Clinic has a lot of resources to offer residents and staff pharmacists. I've been in both worlds there as far as being a resident and now working here. We have dedicated resources for our residents as far as research goes, a specific curriculum that they go through in the beginning of the year. There's also a lot of resources around clinical practice, so a lot of different pharmacy grand rounds or grand rounds that are dedicated for different specialty areas.
So Eau Claire is a smaller community, which has been great for me to experience coming from a larger community. There's much less traffic, and also you get to establish relationships with patients over time. I just had the other day while I was out doing some errands, I had a patient recognize me that I had helped this past weekend, and so he recognized that I was the pharmacist and came up to me and just thanked me for my help the other day. Here, people do recognize you and you get to have that follow-up with them over time.